Historical context. The historical understanding of congenital heart defects has evolved with the progress of medical science. Early recognition of heart anomalies dates back centuries, but detailed understanding awaited the advent of advanced imaging and surgical techniques in the mid-20th century. The establishment of pediatric cardiology as a specialized field marked a turning point, facilitating the exploration of innovative treatments and interventions. Types and classification. Atrial septal defect, ASD. Deeper insight. ASDs vary in size and location. Small ASDs may not cause noticeable symptoms, while larger ones can lead to complications such as pulmonary hypertension. Ventricular septal defect, VSD. Deeper insight. The consequences of VSDs depend on the size and location. Small VSDs might close on their own, while larger ones may require surgical intervention. Tetralogy of Fallot. Deeper insight. Tetralogy of Fallot poses challenges in oxygenating the blood. Surgical correction is typically necessary, and advancements in surgery have significantly improved outcomes. Patent ductus arteriosus, PDA. Deeper insight. If left untreated, PDA can lead to complications such as heart failure. Medications or surgical closure are common interventions. Transposition of the great arteries. Deeper insight. Surgical correction, often involving arterial switch procedures, is necessary shortly after birth to redirect blood flow appropriately. Causes and contributing factors. Genetic factors. Deeper insight. Understanding the genetic basis of CHDs has implications for family planning and early intervention. Advances in genetic testing have enhanced our ability to identify hereditary factors. Environmental factors. Deeper insight. Maternal exposures during pregnancy, such as certain medications or infections, can impact fetal heart development. Avoidance and awareness are critical components of prevention. Chromosomal abnormalities. Deeper insight. Conditions like Down syndrome associated with an extra chromosome 21 elevate the risk of CHDs. Prenatal screening can help identify such chromosomal abnormalities. Effects on the heart. Volume overload. Deeper insight. Increased blood flow through abnormal connections strains the heart, potentially leading to enlargement and reduced efficiency. Pressure overload. Deeper insight. Obstruction to blood flow or increased workload on specific heart chambers can result in hypertrophy and compromised function. Cyanosis. Deeper insight. In conditions like tetralogy of Fallot, inadequate oxygenation leads to cyanosis. Surgical correction aims to improve oxygen levels. Symptoms. Cyanosis. Deeper insight. Cyanosis can be a crucial clinical sign indicating the severity of oxygenation issues. Prompt medical attention is essential. Difficulty breathing. Deeper insight. Respiratory distress is common, especially during activities that increase the demand for oxygen. Management may involve medications and surgery. Poor growth. Deeper insight. Infants and children with CHDs may experience failure to thrive. Early diagnosis and intervention are crucial for normal growth and development. Diagnosis. Fetal echocardiography. Deeper insight. Advances in imaging allow for the detection of certain CHDs before birth, enabling early intervention planning. Echocardiogram. Deeper insight. This non-invasive imaging technique provides detailed information about heart structure and function, guiding treatment decisions. Electrocardiogram, ECG or EKG. Deeper insight. ECG recordings help assess the heart's electrical activity, identifying arrhythmias or abnormal conduction. Treatment. Medications. Deeper insight. Medications may include diuretics to manage fluid retention and improve symptoms or medications to regulate heart rate and rhythm. Surgery. Deeper insight. Surgical interventions range from closing septal defects to more complex procedures, such as arterial switch operations for transposition of the great arteries. Catheter-based interventions. Deeper insight. Advances in catheter-based procedures allow for less invasive interventions, such as closing certain defects without open-heart surgery. Prevention. Prenatal care. Deeper insight. Early and comprehensive prenatal care is vital for monitoring fetal development and identifying potential issues. Genetic counseling. Deeper insight. Genetic counseling aids families in understanding the risk of CHDs and making informed decisions about family planning. Avoiding teratogens. Deeper insight. Pregnant women are advised to avoid substances known to increase the risk of birth defects, emphasizing the importance of a healthy lifestyle. Folic acid supplementation. Deeper insight. Adequate folic acid intake, especially in the early stages of pregnancy, is associated with a reduced risk of certain CHDs. Congenital heart defects represent a complex spectrum of conditions that require a multifaceted approach to diagnosis, treatment, and prevention. Advances in medical science and technology, coupled with increased awareness and genetic understanding, have significantly improved outcomes for individuals with CHDs. Ongoing research continues to shape the field, offering hope for further enhancements in early detection, intervention, and overall care. The collaborative efforts of healthcare professionals, researchers, and advocacy groups contribute to a more comprehensive understanding of congenital heart defects, ultimately enhancing the quality of life for those affected. Ongoing research and future directions. The landscape of congenital heart defects is dynamic, with ongoing research initiatives exploring new avenues for diagnosis, treatment, and prevention. Here are some key areas of interest. Genomic medicine. Deeper insight. Advances in genomic medicine are shedding light on the genetic basis of congenital heart defects. Precision medicine approaches are being explored to tailor interventions based on an individual's genetic profile. Fetal interventions. Deeper insight. Pioneering techniques allow for interventions to be performed on the fetus, correcting certain defects before birth. This evolving field holds promise for improving outcomes and reducing the severity of heart anomalies. Regenerative therapies. Deeper insight. Research into regenerative medicine aims to repair or replace damaged heart tissue. Stem cell therapies and tissue engineering hold potential for restoring normal cardiac function. Patient-centered care. Deeper insight. The emphasis on patient-centered care recognizes the unique needs of individuals with congenital heart defects. Supportive care models, including psychological and social support, are integral components of comprehensive management. Challenges and considerations. While advancements are promising, challenges persist in the realm of congenital heart defects. Access to care. Deeper insight. Disparities in access to specialized care and treatments exist globally. Addressing these disparities is crucial to ensuring that all individuals, regardless of geographical location or socioeconomic status, receive optimal care. Long-term follow-up. Deeper insight. The transition from pediatric to adult care poses challenges, and ensuring continuous specialized care throughout a patient's lifespan is essential. Long-term follow-up addresses potential complications and adjusts interventions as needed. Psychosocial impact. Deeper insight. Living with a congenital heart defect can have significant psychosocial implications. Support networks, including patient and family advocacy groups, play a vital role in addressing emotional and mental health needs. Global impact and advocacy. Congenital heart defects are a global health concern, and advocacy efforts contribute to awareness, research funding, and policy changes. Key aspects include global awareness campaigns, deeper insight. International campaigns such as World Heart Day raise awareness about congenital heart defects, fostering a global understanding of the impact and the need for continued research and support. Research collaborations. Deeper insight. Collaborative efforts between researchers, medical professionals, and advocacy groups enhance the sharing of knowledge and resources, accelerating progress in the field. Policy advocacy. Deeper insight. Advocacy groups work to influence policies related to healthcare infrastructure, access to specialized care, and research funding. Policy changes can positively impact the lives of those affected by CHDs. The human stories. Behind every statistic and medical advancement are the personal stories of individuals and families navigating the challenges of congenital heart defects. Sharing these narratives fosters understanding, reduces stigma, and inspires ongoing efforts in research and support. Conclusion. Congenital heart defects represent a dynamic and evolving field where medical science, technology, and human resilience intersect. As research continues to unveil the intricacies of these conditions, the focus on personalized, patient-centered care remains paramount. The collaboration between medical professionals, researchers, advocacy groups, and the individuals and families impacted by congenital heart defects fuels progress and contributes to a future where early diagnosis, effective treatments, and prevention strategies enhance the well-being of every individual born with a congenital heart anomaly. Historical context. The historical understanding of congenital heart defects has evolved with the progress of medical science. Early recognition of heart anomalies dates back centuries, but detailed understanding awaited the advent of advanced imaging and surgical techniques in the mid-20th century. The establishment of pediatric cardiology as a